Swelling in the feet can be a bothersome event in pregnancy. The reasons for that and the remedies for that is the content of the coming video. I am Dr. Shobhana Mohandas. I work as a consultant gynecologist and laparoscopic surgeon at Sun Medical Center, Thrissur, Kerala. Swelling in the feet, or oedema as we call it, can happen during pregnancy because of excess of estrogen, progesterone, and cortisol. This can cause waterlogging not only in the feet, can happen in the face or even in the hands. Wherever it happens, even if there is a swollen look for the patient, it's not really to be worried about. So, what to do? Yes, edema generally brings to the mind ideas that the heart is failing. So, first see a doctor, make sure that there is no medical problem. Generally, edema can be an indication of coming blood pressure increase in pregnancy. So, check the blood pressure. Get the kidney function test done because sometimes the facial swelling can be because of kidney failure. So, check the renal function. If that is normal, nothing to worry. BP is normal, nothing to worry. One of the feet alone is getting swollen, then that can be because of deep vein thrombosis or blood clotting in the leg. That also requires medical attention. So, if all these things are just scored out, which is 99% of the time, you just have to not worry about the edema. So, what to do about it? We can try home remedies. Teachers or people who need to stand a long time for a long time just to take class or explain things, such people should not stand for too long. They must walk in between for some time. In some professions, you have to sit for a long time with the feet hanging down. That's also not good. So take trouble to find some place where you can put your feet up, and while lying down or even while watching TV or something like that, put your feet up on a pillow. While lying down, it makes sense to lie on one side, mostly on the left side, because the blood vessels are there in between the baby and the backbone. Because this edema starts after around 5 or 6 months. At that time, the uterus has grown up enough to press on the back blood vessels in front of the backbone. That will decrease the blood flow in the baby's patient's body, and that will lead to waterlogging. Therefore, lying on one side can be helpful. Massaging by another person or by self can reduce the edema to some extent. Hanging the feet in warm water can also be helpful in reducing the edema. Another thing could be wearing stockings which go up to the above the knees. This is mainly useful in patients with varicose veins. Even otherwise, just improving the blood circulation towards the heart can be useful while wearing these stockings, and it can be useful. Besides all this, what about the food items? Contrary to what you might be imagining, drinking a lot of water will actually reduce the waterlogging in the body by helping the kidneys to function more and more and throwing out the water. Second thing is, we know that sodium causes waterlogging. So when there is more sodium, there is waterlogging. How can we reduce the sodium? Pregnant women who have edema, they should reduce snacks which contain salt in them, whether they are banana chips or any other snacks which are loaded with salt should be reduced. That will reduce waterlogging. They should eat more food which contains potassium. Plain coconut water contains a lot of potassium. Oranges, avocados, even pumpkins, and bananas. These are things which will have a lot of potassium, and you can improve the intake of these food items. So, drinking a lot of water and reducing sodium does have a lot of effect. In my practice, I have seen that edema of pregnancy does reduce to a great extent with barley water, and that can also be tried as a home remedy in patients with edema of feet in pregnancy. When all these things don't work, maybe when it is really beyond no control, doctors may give us small little pills, and these pills can help in reducing the edema. But too many of them are not good because the pills by themselves may reduce the potassium, and that's not good for us. So that's why the pills are given as a last resort and to a small extent. So, in short, edema of the feet, if because of just hormone changes, it can be countered to some effect by natural remedies. Otherwise, small little bit of medicines can help, but always checking for blood pressure and kidney function is good. I hope you enjoyed this video. Thank you so much.